you be asking for other states to give up their allocations of Pfizer to be sent urgently to Southwest
Well,
Sydney?
I think they are conversations we need to have in National Cabinet. We need to at least have a strategy in National Cabinet that does think about the options for getting more jabs in arms in Sydney, especially in those 5 local government areas. And that's why we're raising the issue. And Dr Chan advised us that it's a national emergency. Her advice also included having a rethink of the national vaccination strategy. We need to work collectively on this. This is not just a challenge for New South Wales, but a challenge for the nation. And I just say that we have been doing the heavy lifting for 18 months in keeping the virus at bay. We've tried to make sure that we keep the economy going, and we want to continue to do that. But in order for us to have our citizens live freely and openly, as well as other states to ensure that their citizens live openly and freely, we need to have a national refocus, and we appreciate and we will continue to work cooperatively with the federal government. But it was my obligation to provide that advice to the public as soon as we received that advice from Dr Chant this morning. It would have been inappropriate or irresponsible for me not to convey that advice that I received from Dr Chant this morning, because I want the community to be aware and ready for whatever decisions we need to take next week. But I also want to stress again that our citizens should look forward to how we can live as freely and as safely as possible in August, September and October, because by the end of October those huge supplies will be here in New South Wales, but we have a gap in the next 4 to 6 weeks. And we need to make sure that we get as many jabs in arms as possible between now and then.
When you say you want to get more, when you say you want to get more first
Excuse me, if you're a bit courteous to each other and just ask one at a time, we'll get through the questions.
That you were announcing a national emergency today.
Well, certainly what we've done in recent days is through the Health Minister, through our health officials and through other channels of the New South Wales Government, convey to the federal authorities our keenness to have further conversations about the national vaccination strategy. That has been apparent. But what the advice we received from Dr Chant this morning was that she regards this now not as only a threat to contain it within New South Wales, but she sees threats to other states. And for that reason, she gave us that advice, and I'm conveying that to the public, in that in order to contain the virus within those local government areas within New South Wales, we need a consideration of a national reconsideration of the vaccination strategy. The advice Dr Chant gave us is that our ability to contain the virus is directly linked to the national vaccination strategy. And that is the information we're conveying today, that the emergency we have in New South Wales is directly linked to the national vaccination strategy, but also could impact other states if we don't have a national focus. And we're not talking about resources that we don't need. We're talking about doses. We're talking about jabs in arms. That is what we need. And we are doing everything we can as a government to make sure that we maximise, in particular, the use of AstraZeneca as much as possible. But we need clear messages around the nation on what and how to do that, because our citizens will gain confidence not just in what Dr Chan and I are saying, but what everybody is saying about the AstraZeneca vaccine. We need clear messages around the AstraZeneca vaccine and getting that information out. But practically, we also need additional, at least first doses of Pfizer, because we know we have a very young cohort, that those particular parts of Sydney have very young populations compared to the rest of the state. In fact, compared to the rest of the nation, some states have much older populations. Other states can rely on AstraZeneca more than we can. Of course, we're encouraging everybody over 40 to go through their GP or come to one of our hubs. And there are millions of people in New South Wales that are over 40 years of age. Can I make that point? There are lots of people in New South Wales in their 40s, their 50s and their 60s that don't have any vaccine. We're saying to everybody, please get vaccinated. If you have any concerns, go to your GP. Otherwise, book with us. We have capacity for more AstraZeneca. We have capacity for people to come forward, whether it's through their GP, through the pharmacists or through our own hubs, to get the jab.